Hello, Kaylee. It looks like you're here to pick up a prescription today.
Yeah, my doctor said he called something in.
Okay, it looks like cholesterol. Do you know how you're supposed to take the medication?
No, not really.
Well, you just take it once a day. Did he tell you what side effects to expect?
No.
Oh, some of the common ones are nausea, vomiting, headache. There are some severe ones like dermatomyositis, liver failure, lupus, rhabdomyolysis, hemorrhagic cerebral infarction. If you have any of those, just call your doctor.
Okay, why am I taking this medication?
It's for your dyslipidemia. Oh, yeah, just one tablet a day. Do you have any questions for me?
No, I guess not.
All right, great. Have a good day. Hello, Kaylee. I see you're here to pick up a prescription today.
Yeah, my doctor said he called something in.
Here the pharmacist did not introduce herself, ask if the patient had time to talk, or explain what the talk was going to be for. She was also chewing gum, which can be distracting to the patient.
Oh, it looks like he called in cholesterol. Do you know how you're supposed to take this medication?
No, not really.
Here the pharmacist stated the name of the medication, but did not explain what it was for. She also used closed-ended questions, which the patient could simply answer yes or no. Closed-ended questions also do not allow us to find out information the patient already knows about this medication.
Okay, well, you take this one once a day. Did he tell you what side effects to expect?
No.
All right, well, some of the common side effects are nausea, vomiting, headache. There are some severe side effects like dermatomyositis, liver failure, lupus, rhabdomyolysis, hemorrhagic cerebral infarction. If you have any of those, you should call your doctor.
Here the pharmacist was just reading off side effects. For the common ones, she listed universal side effects that are not likely to happen with this medication. For the severe ones, she used medical jargon and listed way too many. This can scare the patient and prevent them from taking their medication.
Okay, so why am I taking this medication?
It's for your dyslipidemia. Oh, and you should take one tablet every day. Do you have any questions for me?
I guess not.
All right, great. Well, have a good afternoon.
The pharmacist in this counseling session has a lot to learn. She covered a few important topics, such as how to take the medication and possible side effects, but overall she was unorganized. She forgot to talk to the patient about storage and did not have the patient use the teach-back method so we could see what she learned. She used closed-ended questions and did not provide all relevant information. Eye contact was minimal, and at some times she was just reading from a list.
Hello, Kaylee. I'm Lori, the pharmacist here at Bulldog Pharmacy. I see that you have a new prescription for cholesterol 20 called in by Dr. Ferris today. I wondered if you had a minute to talk to me. I just want to make sure that you know how best to take it and if you have any questions.
Sure, I'm just getting a few groceries.
Okay. What did the doctor tell you cholesterol is for?
Well, he told me that I had a blood test for cholesterol and that I should start taking this.
He's right. This medicine is designed to help lower your cholesterol, and that means that it will help lower your risk of having a heart attack or a stroke. How did your doctor tell you to take this medicine?
He didn't really tell me, he just phoned it in.
Okay, well, you're going to take one tablet of cholesterol 20 one time a day by mouth, and you can take that with or without food. When do you normally take your medications?
Well, I take all of my other medications right before I go to bed, so I guess I could take it then.
Okay, that's perfect because cholesterol works best if it's taken at night, though you can take it any time of the day. And you should take it every single day. It's important to keep that up. Where do you store your medications?
I store my medications in my nightstand right by my bed.
All right, do you have any children in your home?
No.
Okay, well then that sounds like a perfect location for you. Medicines keep best if they're stored away from light and heat and moisture. What did the doctor tell you to expect in terms of side effects?
He didn't mention anything about that.
All right, well this medication is pretty well tolerated, which means it doesn't have very many side effects. But you might experience some mild muscle aches and pains. If they seem really severe to you, then you should call Dr. Ferris and talk to him about that. Also, this medicine can interact with a lot of other medications and even over-the-counter things, so check with the doctor or myself before you start anything new. And lastly, grapefruit juice can interact with cholesterol 20. So if you use grapefruit juice every day, I probably would switch to a different juice while you're on this medication. Just so I know we're on the same page, can you repeat back to me how you'll take this medicine?
Sure, I'm just going to take one tablet right before I go to bed with my other medications. And I guess I'll switch to orange juice. And if I notice any muscle pain that is severe, I'll call Dr. Ferris right away.
Great, Kaylee. I know we went over a lot today. What other questions do you have for me?
I think you answered all my questions. Thank you.
Fantastic. All right, well, here's your prescription. I even put it on autofill for you so that it will be filled for you at the same time every month. And if you have any other questions later, our phone number is right here on the bottle, and you can call me at any time. Thanks so much. Have a great day. Hello, Kaylee. I'm Lori, the pharmacist here at Bulldog Pharmacy. I see that you have a new medication to pick up today, called in by Dr. Ferris for cholesterol 20. Do you have a minute to talk about it? I want to make sure that you know how best to take this medicine and to answer any questions that you might have.
Here, the pharmacist introduces herself, identifies the patient and medication. She then makes sure the patient has time to talk while explaining the point of the counseling.
Sure, I'm just getting a few groceries.
All right. What did the doctor tell you cholesterol is for?
This is the first of the 3 prime questions. What did your doctor tell you this medication is for? When asked an open-ended question, patients must consider the question and come up with an answer, instead of just agreeing and nodding.
He told me that I had a blood test for cholesterol, so that I should start taking this medication.
All right, and he's right. This medication will help lower your cholesterol, and it will help lower your risk of having a heart attack or a stroke. How did the doctor tell you to take this medicine?
Here, the pharmacist reaffirms that the medication is for cholesterol and tells the importance of taking it. She then asks the second of the 3 prime questions. How did your doctor tell you to take this medication?
He didn't tell me, he just phoned it in.
All right. Well, you're going to take 1 tablet of cholesterol 20 one time a day by mouth, and you can take that with or without food. When do you usually take your medications?
I take all my other medications right before I go to bed, so I guess I could take it then.
That's perfect. This medication can be taken any time of the day, but it does work best if taken in the evening, and it's important to take it every day.
Here, the pharmacist explains how and when to take the medication. She also praises the patient for taking her current medications while stressing adherence.
Where do you store your medications?
I store them all in the nightstand by my bed.
Do you have children in your house?
No, I don't have any kids.
All right, so that sounds like a perfect place for you to store those. Medications are best when they're stored away from light, heat, and moisture.
It's important to assess where patients store their medications. Many people leave them in hot cars or in steamy bathrooms, and that can be detrimental to the medication. But if the patient can't remember to take the medication, if it's not in the bathroom, that may be the best place for it. She also asks about children to make sure that the nightstand is not an inappropriate place where children could get into the medicine.
What did your doctor tell you to expect in terms of side effects?
He didn't mention anything about that.
All right, well, this medication is usually well tolerated, which means that it doesn't have very many side effects, but you might experience some muscle aches or pains. If they seem really severe to you, then you should call Dr. Ferris and talk to him about that. Also, this medication can interact with over-the-counter medicines or even other medications, so before you start something new, you should check with either Dr. Ferris or myself. And lastly, this medication can interact with grapefruit juice, so while you're taking this medicine, I would avoid grapefruit juice.
Here, the pharmacist asked the 3rd prime question. What did your doctor tell you to expect? She then told the most likely side effects and precautions with this medication. She did not include a laundry list of things that are not likely or could scare the patient. She did not also include nausea, vomiting, or diarrhea, which should only be mentioned if likely with this medication.
Just so we know we're on the same page, can you repeat back to me how you're going to take this medicine?
Sure, I'm just going to take 1 tablet of the cholesterol in the evening with all my other medications. And I guess I'll switch to orange juice. And if I notice any bad muscle pains, then I'll be sure to call Dr. Ferris right away.
Asking the patient to teach back what they just learned, make sure that they listen to your advice and will be comfortable taking this medication.
That's great, Kaylee. I know we went over a lot today. What questions do you still have for me?
I think you answered all my questions. Thank you.
All right, good. Well, here's your prescription. I even put it on autofill for you so it'll be ready at the same time every month for you. And if you have any questions later, our phone number is right here on the bottle, and you can call me at any time. Thanks so much. Have a great day.
Lori did a great job. Her counseling was organized and used open-ended questions. She did not have distracting mannerisms and used a pace, volume, and tone that was appropriate for the patient. She avoided medical jargon, but still talked about all of the most important parts of taking this medication.